Hello everyone, I am Dr. Bhupesh Singh. I am a cornea specialist at Bharti Eye Foundation and Hospital, New Delhi. So today I am going to talk about the diseases of cornea and its treatment. If we talk about the cornea, it is first to understand what is cornea. So cornea is a black part of the eye that we can see. It can have different colors like brown, sometimes appears black, but if we talk about scientifically, it is always a clear like glass, and the color which is there inside the eye, the cornea appears of the same color. So there are different problems that can happen to cornea, like corneal infections, corneal trauma due to some injury, or keratoconus or corneal dystrophies, and there are different treatment modalities for all these problems. So corneal infection is one of the most common problems that we all encounter, and patients with corneal ulcer in which the cornea start becoming white. Sometimes we need medication for that, like eye drops, that helps, antibiotic eye drops. But in advanced cases, when the cornea is totally opaque or totally white, the patient requires corneal transplant. So corneal transplant is only one thing that we can change inside the eye. It is a myth that whole eye can be transplanted. The fact is that only cornea can be transplanted. So for corneal transplantation, we need a donor. So there are different eye banks that provides cornea to the different hospitals. So if any patient whose cornea is white and the rest of the thing inside the eye is normal like nerve and retina, then that patient is suitable for corneal transplant. So corneal transplant surgery is not so difficult. It takes around 1.5 hours to perform this procedure. But post-op care after corneal transplant is very important. You need a lot of medications, regular follow-up with the doctor, at least for first year, and then every 6 months you should come to the doctor and show how it is going. If we talk about the limitation or the main challenges in corneal transplant is the rejection that is there in few cases of corneal transplant, or chances of getting infection. So if we talk about the rate of rejection, it is usually 5 to 10% after the corneal transplant surgery, and if we talk about the infection, it is also 5 to 10% after the surgery. So regular follow-up with the doctor and proper usage of medication, you can avoid these problems. Now coming to the different types of transplants that are there now. So the conventional corneal transplant is changing the whole cornea, whole black part of the eye, that is called penetrating keratoplasty, in which we change the entire cornea and replace it with the donor cornea and fix it with the stitches. But the latest or the newer transplants are the lamellar corneal transplants, that is deep anterior lamellar keratoplasty or DSEK surgery. So in DLK or DSEK, that is the deep anterior lamellar keratoplasty surgery, so the indications are different. So in patients who are of keratoconus, who are having keratoconus, in which the disease part is the front part of the eye, not the entire cornea is involved, then we have to perform DALK. So the advantage of DALK or DSEK in comparison to the conventional technique is that recovery is faster, chances of rejection is lesser, chances of infection is lesser, and success rate is better. So if any patient who is having white cornea or due to some injury or any infection, that patient should come to the cornea specialist for the surgery. So if you want to have any information regarding corneal transplant or any queries regarding the surgery or the estimate or the cost involved or the follow-up duration or follow-up method is involved, you can contact us. Feel free to contact us at Bharti Eye Hospital.